Lupus is a potentially deadly autoimmune disease, and Toni Braxton has become the celebrity face for this disease. She says it took her 4 years to get a proper diagnosis, and that's because lupus has become the top 5 most missed disease in the world. Now, joining us now is Dr. Elliot Rosenstein. He is the director of the Institute for Rheumatic and Autoimmune Diseases at Overlook Medical Center, and we welcome you back to Edward today. Always good to see you.
Good to see you, Mia. Thank you.
What exactly is lupus, if you can explain to folks who might not know? And I actually had to do a little research on it myself.
It's a tough question. Lupus is the classical autoimmune disease, and by autoimmune we mean a situation where the body's immune system, which is normally designed to fight off external invaders like bacteria and viruses, makes a mistake and starts to attack its own tissues. And in lupus, virtually any tissue in the body can be affected.
So what are some of the symptoms, and why has it been so hard to diagnose? I mean, we talked about Toni Braxton just a second ago, where she actually says that it took her 4 years to get a proper diagnosis.
Well, fortunately, in many people, it presents in a mild fashion. People can have rashes, people can have joint pain, sometimes joint swelling, low-grade fevers. It doesn't present in a full overblown fashion where internal organs can be affected. When kidneys are affected, when the lungs or the heart are affected, it's not such a subtle diagnosis, and it's much easier to establish what's really causing the issues.
Let's take a look at what Toni Braxton said about her diagnosis of lupus.
Although I had issues in the past, it's really challenging to diagnose, as you mentioned earlier. But it was when I had microvascular angina. They said, we don't understand why she has this, and they checked my blood, and my white blood cells have always been a little low, but it was like a 1.97. They said, wow, that's very low, bit of anemic when that's involved. But all these tests prove I didn't have a high SED rate. I don't know if you know that. That means inflammation in your bloodstream, in your body. And mine was like a 7. So they didn't understand that. And it took a long time. It was a specialized test.
Did you need to get other opinions, or what was the time period?
I looked up at the last minute, and they said the remedy for this is a heart transplant. I just remember them telling me that. And I'm like, what do you mean?
Can you imagine? Let's try to avoid that.
And then 24 hours later, they happened to do this test 2 days before, and the test results came back, and they said, you have lupus.
So you actually got your diagnosis.
Why do so many women get lupus as compared to men, and are there some environmental factors as to why people get this autoimmune disease?
Well, it's always felt to have had some hormonal influence. So the typical person who has lupus is a woman. It's about 10 times more frequent in women than men, usually between the ages of 15 and 50. So that corresponds with the onset of puberty and with menopause. So estrogen has always been felt to have a strong influence on the development of lupus. But it's not simply estrogen. It may be the combination of estrogen and progesterone. It may be other hormones like prolactin that may be coming into play. Men get it also. Interestingly, men who have an extra X chromosome get lupus more often than men who don't have that chromosomal abnormality. So there may be something on the X chromosome.
Interesting. Well, does it ever go into any kind of like remission, like cancer does?
It can go into remission, but that's the exception rather than the rule. Most people that have lupus have it chronically. Most people that have the systemic form of the condition need to take some sort of medication to keep it under control. There's some people that have very limited presentations of the condition that can get by without medication on an ongoing basis, usually just involving the skin. One of the comments that Toni Braxton made about laboratory test abnormalities, sometimes the laboratory test will show evidence of lupus before there's any other evidence, before the skin, the joints, kidneys or other internal organs are affected. And usually people who just have the laboratory evidence of the condition don't need to be treated.
And I know it can be very painful, especially if it gets into the joints, but what if you don't treat it? Then it can be potentially deadly?
It can be potentially deadly if internal organs are affected, and the ones that we worry about the most are the central nervous system and the kidneys.
And again, if any kind of symptoms, you should go immediately, obviously, to a doctor. So fever, joint pain, rash, anything like that. So anybody that has anything like that should go see a doctor immediately.
Right. Doctors should evaluate it, and most likely the patient will be referred to a rheumatologist, and that's the medical specialist that most often takes care of patients with lupus.
And what is the treatment for lupus?
Well, the treatment is really directed towards whatever manifestations the patient has. So if it's skin, it's much easier to treat than if it's kidneys. Generally, steroids, corticosteroids, not the steroids that the athletes use, steroids are used to try to control the condition. Sometimes we use some of the medications that were originally developed to treat cancers in the treatment of autoimmune conditions like lupus also.
Why would steroids be helpful in treating lupus? Just if you can clarify that one.
Well, there are two major types of steroids. There are the anabolic steroids, which enhance performance and,
Sure.
and sometimes get abused by athletes. And then there are catabolic steroids, cortisone-based steroids, and they're very effective for controlling inflammation.
Well, Dr. Elliot Rosenstein, always a pleasure to see you. This has been fascinating. We hope you come back to Edward today.
Love to, thank you.
Thanks, sir.